Healthcare in America is undergoing a massive transformation. The Trump administration's 2025 policies are reshaping how we access care, how much we pay, and how public health agencies operate. In this video, I'll break down these changes, what they mean for U.S. citizens, and how you might feel them where you live. The Department of Health and Human Services, or HHS, has been restructured to consolidate divisions and cut its workforce. The goal? Streamline operations and centralize services. National impact. Fewer staff may slow federal responses to public health crises, drug safety monitoring, or emergency preparedness. Centralization could mean decisions are made faster, but potentially with less regional input. State impact. States may need to fill gaps left by federal downsizing, from health data tracking to emergency logistics. On the positive side, the administration has doubled down on price transparency. New executive orders require hospitals, clinics, and insurers to disclose prices in ways patients can actually use. National impact. Patients can shop around, potentially saving money on surgeries, diagnostics, and medications. Providers may face pressure to lower prices in competitive markets. State impact. States with high healthcare costs, like California or New York, may see more rapid price competition in urban centers. Rural states may see less change if provider options are limited. The administration has also aimed to reduce drug costs by limiting Medicare outpatient drug reimbursements. This targets hospitals that mark up drug prices significantly. Medicare Advantage plans have received payment boosts, encouraging seniors to join these private-run plans. Meanwhile, proposed Medicaid changes include work requirements and reduced federal funding for certain programs. National impact. Millions of seniors could see more Medicare Advantage plan choices, but also more complexity in comparing plans. Medicaid enrollees in affected states could lose coverage if they don't meet new work or reporting requirements. State impact. States that expand Medicaid with federal waivers may face funding cuts, forcing them to scale back programs or find new funding. States that choose to implement work requirements could see coverage losses, increasing strain on local safety nets. Ending several CMMI payment models could reduce experimental programs aimed at improving care while cutting costs, potentially saving taxpayer money but slowing innovation. Significant staff reductions at the NIH and FDA are raising concerns about the future of medical research and drug approvals. National impact. Drug approvals could slow, delaying access to new treatments. NIH-funded research projects on diseases like cancer, Alzheimer's, and rare conditions could lose steam. State impact. States that house major research centers, think Massachusetts, Maryland, California, could see job losses and reduced federal grant funding. Smaller states might lose out on NIH-funded public health initiatives. The administration's healthcare agenda also includes policy shifts around gender-affirming care for minors, partnerships between NIH and CMS to study autism causes, continued deregulation in several sectors of healthcare delivery. Together, these changes point to a broader theme: cost control, deregulation, and shifting responsibility to states and private markets. What citizens should expect: more tools to compare healthcare prices, potential cost savings, but also more out-of-pocket risk, reduced federal role in safety net programs, slower pace of public health research and innovation. The long-term effects? They're still unfolding. What's clear is that U.S. citizens, whether patients, providers, or caregivers, need to stay engaged, informed, and ready to navigate this new healthcare landscape. Subscribe to stay ahead of policy changes that impact your care and your community. And if you need help planning for these shifts, visit us at Simplified Solution Systems.